name is Sabrina and I'm a student at Montgomery County Community College, and I'll be going over your discharge instructions and answer any questions that you may have.
Okay.
The doctor has prescribed a fentanyl patch, which is 12.5 micrograms per hour, and it should be changed every 72 hours, which is every 3 days. Do you know anything about the patch?
No.
The patch is an opioid receptor, and it blocks signals in the central nervous system that suppresses pain. It is prescribed to patients that experience severe pain that are tolerant to narcotics. And the patch, I'm going to go over the application and then I'll demonstrate it to you, and then you're going to demonstrate it back to me to ensure that you have learned whatever is being taught.
Okay.
Okay, the patch. It should be applied to a clean area. The area must be cleaned with water, no soap, no oils, no lotion, which can prevent the patch from sticking. It should be applied to intact skin, not irritated skin, no cuts, no wounds, no drainage, no anything like that.
Okay.
If hair is on the area that is being applied, the hair has to be removed, the skin cleansed, and then the patch is applied. It can be applied to the chest, the arms, or the back. And the site should be rotated every application, which is every 3 days.
Okay.
The patch has a protective layer that should be peeled off before the patch is applied to the skin. And for disposal, the patch has to be folded inwards and properly disposed. Because it's a transdermal patch, the medication can be transferred from the skin to the patch or from the patch to the skin. The patch can get wet, but it cannot withstand heat because heat increases the rate at which the drug is administered. The most common side effects are nausea, vomiting, constipation, drowsiness, dizziness, and confusion. The patch should be kept away from kids and pets. As I stated before, it can be transferred through the skin. The medication should be taken as prescribed. Pain relief won't occur right away. It gradually comes on because the patch is not an immediate release for pain. The drug should be withheld if the pain continues, the pain worsens, or you have sensitivity to pain. And report any signs of drug toxicity and overdose to your provider. Alright, I'll be getting the patch and performing hand hygiene. I'll be back to demonstrate the patch onto you, okay?
Okay, thank you.
Alrighty, I have the patch here. I wore gloves because, as I stated before, it passes through the skin. So I'm just going to demonstrate the patch, and then you're going to demonstrate it back to me. We're going to open protective covering of the patch. I'm just going to put the date and time on the patch so you'll remember that every 3 days from date of application that you change the patch. So today is 4/3/24, and the time is 13:32. So we put the date and the time on the patch.
Okay.
Okay. So we're gonna cleanse the area, remove any hairs, oils, or anything from the skin. Then we're gonna peel off the patch and place it on the skin. We're gonna press tightly for 30 seconds just to make sure the patch is sticking correctly. Then we're gonna just dispose of all this, and then 3 days from now you change the patch. So now I need you to demonstrate it back to me, okay?
Okay.
And you're gonna cleanse the skin.
Cleanse the skin. There you go. 30 seconds.
Yes, and then the pack should be changed every
Every
3
3
days.
days.
Okay, then when you take it off, you're gonna, sorry, just take it off like this, and then you're gonna fold it inside out,
Okay.
and then you just dispose of it in the proper waste container. And that's it. Alright, I'll be getting your discharge instruction along with the medication for you to go home, okay?
Okay, thank you.
You're welcome.
Bye.